Assalamu alaikum. So I'm here today with my new lecture on menopausal hormone therapy, which is most commonly known as hormonal replacement therapy. So today we will only discuss those MSG drugs that are available in Pakistan, their brand names, because most of the students who go for OSCEs and examinations, they don't know the types of drugs that are available for MST in Pakistan and how to prescribe these drugs. So we will only discuss the drug portion today. Rest of the menopause and its symptoms and the need for drugs, they will be discussed in separate lecture. Okay, the symptoms which needs and improves on menopausal hormonal therapy, these are the symptoms. They include mood swings, joint and muscle pains, sleep disturbances, sexual improvement, quality of life, premature ovarian failure and cessation of periods before age 45 years, urogynecological symptoms. So these are all symptoms which will improve on menopausal hormonal therapies. Okay, so these are the routes of administration by which we can prescribe MSG drugs in Pakistan. They are oral, vaginal creams and pessaries, and intrauterine devices. So what types of menopausal hormonal therapies are available in Pakistan? Conjugated equine estrogens, which we prescribe as topical vaginal creams. They are made up of mixture of sodium salts of estrogen conjugates, which is found in horses. Another one is estradiol valproate. Estradiol valproate is an estradiol ester or prodrug of estradiol, and it has the same functions as estradiol, but it is weak in intensity as compared to estrogen or estradiol. Norgestrel, it is a progesterone or agonist of progesterone receptor, and it is a second generation of progesterone. So both of these drugs are both of these generations are found in many HRT drugs. Another one is dydrogesterone that is available by most commonly by the brand name of Difestrone. So what it is a synthetic progesterone and progesterone receptor agonist. Now, short brief review of the generation of progesterones. The first generation progestogens, it includes norethindrone, linestranol and norethistron, which is available by name of Pramalit N in Pakistan. Second generation of progestogens include levonorgestrel and norgestrels. Third generation include desogestrel. Desogestrel is the newest progesterone, and the benefit of this drug is it minimizes androgenic effects and estrogenic activity. So it has less of those side effects that are because of progesterones. The females experience those side effects that includes bloating, headaches, and weight gain, hirsutisms. So it has less of all these side effects. But the newer generations of progesterogens, they have a highest risk of venous thromboembolisms. This is a side effect. Okay, now topical estrogen which we discussed. So it is available by name of conjugated estrogen vaginal cream, conjugated equine estrogens. It is available by two brand names, Premarin and Estromarin. The strength of both of these drugs is same, that is 0.625 milligram. Indications for its use are vaginal dryness, soreness, itching, perineal heaviness, urge incontinence, and atrophic vaginitis and dyspareunia. So how to apply? It has to be applied daily for at least 15 days. Minimal time period is 15 days. Up to 3 months it can be prescribed along with the follow-up. And whenever a postmenopausal female, she presents with the UV prolapse and it has kind of ulcers on it, so we can also prescribe one of the indication is that as well, to heal those ulcers before surgery. So this is a conjugated estrogen vaginal cream. Okay, now talking about oral estrogens. Oral estrogen we can only prescribe to those women who do not have uterus. So if a woman has undergone total abdominal hysterectomy and DSO due to endometriosis, or she has hysterectomy due to adenomyosis or any other reason, we can prescribe oral estrogen to those females. It is available in two forms. First one is conjugated estrogen, that is the same as that local cream. It is available by name of Premarin, and the strength is same, 0.625 milligram. Now, if you talk about another is only estrogen cream, it is in the form of estradiol valproate, and the brand name is Progynova. Its strength is 2 milligram, and this packet has 28 tablets in it. There are many other indications for its prescription, like if a female has a complaint of hypogonadism, if she has premature ovarian failure, or if she has never menstruated in her life cycle, if she has a small uterus, that is because of a hypogonadism again, and if she has had her hysterectomy, so we can prescribe Proganova. And one more indication is androgen insensitivity syndrome, in which a female does not have uterus, but she has secondary sexual characteristics. So to maintain those characteristics, she is prescribed Proganova till her age of menopause. So this packet has 28 tablets, and it is available, very available, easily available in Pakistan. Okay, now another regime is combined estrogen and progesterone, and it is prescribed for women with uterus. So the first one is estradiol, combination of estradiol valproate and norgestrel. It is available in a strength of 2 by 0.5 milligrams. So 2 milligram is estradiol valproate and norgestrel is 0.5 milligram. Name is tablet progylutin. It has 21 tablets, 11 white tablets and 10 red tablets. So this is very easily available in Pakistan again. It can be given in premature ovarian failure and to postmenopausal females if she has symptoms. Estradiol and dydrogesterone. This is available by brand name of Famostan. Famostan tablet is available in two strength. First one is 1 by 10 milligram. Another one is 1 by 5 milligram. So 1 by 10 milligram tablet, it is indicated after 6 months or more after last menstrual period. So not an year, but it can be prescribed if 6 months have passed after last menstrual period and the female has started her symptoms, because progesterone is in higher strength in this form, 10 milligrams, so the female experiences breakthrough bleeding. So she has to be counseled regarding this thing. Another strength of famostan is 1 by 5 milligram. It is indicated after 12 months or more from last menstrual period, and this is a continuous regime of 28 tablets in which there is very less chances of breakthrough bleeding. This is tablet progyluton. Like I explained that it has 11 white tablets and 10 red tablets. These red tablets are progesterones and 11 white tablets are estrogen derivatives. Okay, so another very important drug, which is also very commonly and widely available all over Pakistan, is Tibolon, which is available in strength of 2.5 milligram, and it is also available with the brand name of Livial, and in some shops as Tibol. So it has combined estrogen, progesterone, and androgenic activity, but the strongest activity of Tibolon is androgen. So it has positive estrogenic effects on bone, brain and vagina. This is very important. But it has lack of effects on uterus, breast and liver. So it can be given to the patients who have had history of breast cancer, also along with some kind of any kind of liver pathology. So it is not dangerous for those women. It is weak agonist of progesterone receptor. However, it has strong androgenic activity comparable to that of testosterone. So its androgenic activity is somewhat same as that of testosterone. It is mainly used to increase libido and sexual activity in menopausal females. It has strong androgenic side effects, thus banned in USA. So it has side effects of hoarseness of voice, as well as acne, hirsutism, baldness, all of the male factors. So it is banned in few countries along with USA. So this is the picture of Tibolon tablet pack. It is available like this, and the strength is 2.5 milligram. It has 28 tablets in one packet. Okay, another drug which is known as Clamin. It is nowadays it is short in the market, but it used to be available in Pakistan, so we should know about the composition. It has estradiol valproate, which is in the strength of 2 milligram, plus cyprotron acetate 1 milligram. The name is Clamin. It has 11 white tablets which have estradiol valproate, which have to be given in the initial part of the menstrual cycle. However, it has 10 pink tablets containing cyprotron acetate, which covers the rest of the part of the menstrual cycle from 12 days onwards. So total it has 21 tablets in the pack. After finishing the pack, there is 7-day pill-free period during which a woman can experience breakthrough bleeding, and she has to start exactly after 7 days another pack of this drug. So this after 7 day during this 7-day pill-free period for breakthrough bleeding, we have to counsel the woman that it might occur, and after that she has to start the pack again. Cyprotron is an anti-androgen and progestin, so it has two activities, and you might all know that cyprotron acetate also works in inhibiting the production of acne and hirsutism, and it is available with the name of Dan 35 in the market, and nowadays there are other brands as well. So its main function is it works as an anti-androgen, and it has progesterone activity as well. Okay, so if you talk about progesterone, so if only progesterone is prescribed for menopausal hormonal therapy, or even along with combination of estrogens, so we have only progesterone options are these, like liver gastroenterouterine system. So we can place IUCD, intrauterine, and the strength of IUCD would be 20 micrograms. Levonorgestrel hormone will be released daily for 24 hours. Another only estrogen drug we have is norethistron, which is available by name of Pramlit N, 5 milligram in the market, and the dose is 1 TTS. And the last one is dydrogesterone, available with name of Difeston, 10 milligram, and if it is along with estrogen, then it is known as Famostan. So these are the progesterone only preparations that can be given along with if we are prescribing estrogen only drugs, which covers the first part of cycle, and progesterone drugs will cover 12 days onwards. So these options we have as well. We can give them in combination along with the estrogen drugs. So this is all from menopausal hormonal therapy drugs which are available in Pakistan. I have explained along with the brand names as well, because our clinicians as well as the practicing gynecologists, they find it difficult to know what drugs are available nowadays in Pakistan. And it will be helpful for the postgraduates as well during the examinations, because some of the specific questions asked are, what do you know about the strengths, the type of ingredient present in the drug, and with what brand name it is commonly available in Pakistan. So these are the commonly asked questions. And in the next lecture, we will be discussing all about menopause, like the symptoms, the stages of female reproductive life, what is premature ovarian failure. So in upcoming lectures we will be discussing these things. So this is all from today's lecture. Jazakallah, thank you so much.